Hi, I'm Bridget Bartley, the Woodrow Wilson Rehabilitation Center. Today I have joining me Dr. Alan Towne. He's a neurologist at McGuire and also at the Virginia Commonwealth University. He's joining us today as a participant with the Virginia Wounded Warrior program, and he specializes in traumatic brain injuries. I'd like to go on and ask you the different blast injuries that you see and the traumatic brain injuries and their similarities, and if you'd like to go on. And
Sure. Traumatic brain injury is really the term we use for any blow to the head. So actually, if you get dinged, if you like run into a doorstop and feel a bit confused or see stars, actually that is traumatic brain injury, and actually it's a mild concussion. There are varying degrees of traumatic brain injury, depending on how bad the injury is. And so generally, if you have one that you're just dinged a little bit and you're a little bit confused, that would be a mild traumatic brain injury. Now, in some cases, you lose consciousness, and that would be a moderate or a severe traumatic brain injury. And there are certain criteria we use to determine what differentiates mild from moderate to severe. Yeah, usually how long you've lost consciousness, if you've been amnestic for the event, and there are certain scales we can use.
And exactly what are the symptoms?
Well, depending on the type of traumatic brain injury, again, you may lose consciousness, or you may not lose consciousness. Now, what happens is that after you've had a traumatic brain injury, and it can be due to various causes. The most common cause in the civilian world is motor vehicle accidents. Right. So you hit another car and your head goes through the windshield. That can cause a traumatic brain injury. What tends to happen afterwards is that what we call a post-concussive syndrome, or a constellation of signs and symptoms that we see after the injury. And in most cases, at least from a neurological standpoint, what we tend to see is that patients will complain of difficulties with thinking. They may complain of headaches. They may complain of dizziness. They may complain of nausea, and sort of difficulty multitasking. And so that's pretty much immediately after the injury. They won't be quite right. They may even have depressive type symptoms.
Right. The longer term effects of traumatic brain injuries with our troops that are very well, quite possibly could be coming home as early as next year. What should we be looking for? And their loved ones, their family members, their support groups when our troops arrive.
Well, I think you need it. Sure, and again, I've been deployed twice to Afghanistan, and so I sort of know. I mean, fortunately, I didn't suffer any traumatic brain injury, but a lot of my soldiers did. Right. So I've been following them since 2005, which was my first deployment, and then I had one last year. So I look for the same symptoms that everyone else should look for, and so part of it would be if they're having difficulty with irritability, if they're having difficulty with increased headaches, if they're having difficulty with multitasking, or they're having problems with processing information. I mean, a common thing is that they'll come back from deployment and they'll be in this rhythm, and then they'll get back to work and say, I just can't function the way I used to.
Right.
And then we have to differentiate. First of all, we have to know, and sometimes they don't remember how bad the head injury was, because some of the blasts that we see with the IEDs, the improvised devices that they put along the roads, is that you may actually be a victim of one, but you may not actually lose consciousness. And some of the soldiers have gone through 4 or 5 or 6 of these IEDs, and they sort of all blend together, and they don't go to see the doctor every time because they just push on, or they may not be a medical professional right there. And so I had some of my people who, at the end of their deployment, I'd ask them, and they said, "Well, I never went to see a medic or a health provider, and I had 5 traumatic brain injuries, and I'm seeing them at the end of the year. So then it's difficult to really quantify, what type of injury they actually had. Then when they got home, they started having these difficulties, as I mentioned, with the headaches, with the dizziness, and the difficulty with concentration.
And Dr. Towne, can I ask you about post-traumatic epilepsy?
That's something that we are very interested in the VA system. In fact, there was a recent bill passed to establish centers of excellence to study epilepsy within the VA system. And one reason we're very interested in this is that we know from previous wars that the incidence of epilepsy or seizures is much higher in those patients who have had traumatic brain injury than those patients who haven't. And one of our major concerns is that the new type of injury that we're seeing with the blast injury, we suspect that actually there'll be a fair amount of a substantial amount of soldiers returning who may develop this, and they don't necessarily develop it right when they're at home. Right when they get home.
Right.
They may develop it years later. In fact, many times we'll see 2 years later they'll start developing these seizures. And they are not your typical seizure where you fall down to the floor and foam at the mouth. Many of them are seizures that we call partial seizures, where there just may be strange behaviors. And they're sometimes very difficult to diagnose. And so you need to, that's why the Epilepsy Centers of Excellence were established, so you'd have a group of specialists looking at this problem, both from the clinical side and also from the research side.
Right. Thank you so much for
Thank
joining
you.
us and being a part of the Wounded Warrior program. You've given us some great information, and thank you so much.
Thank you.